Can you talk about surgical menopause for a moment? And I don't know if this is a question or a statement, but she says, will we be okay, with lots of exclamation points? I'm thinking maybe she meant question marks, but I'm not sure.
Well, listen, surgical menopause is its own unique menopause. It's these women are often neglected. Now, listen, the reason why you had surgical menopause may impact what your options are. Will you be okay? Yes. If you're talking about menopause, yes. So surgical menopause is different because it's abrupt. It happens overnight, right? You remove the ovaries, you remove dramatically estrogen, progesterone, and 50% of the source of your testosterone, right? If it happens early, so before the age of 45, and certainly before the age of 40, well, that is really significant because you go from functioning hormonally to having basically zero hormones overnight, not okay. And those women, unless there's some real true contraindication, they should frankly be waking up with that prescription or that estrogen patch already on, frankly.
Yeah.
So that's number one. If you were already menopausal or around the age of, I should say, if you were around the age of natural menopause, a lot of doctors just minimize you then having surgical menopause. So for instance, you're 49 or you're 50 and your periods are already irregular. Maybe you have a little bit of hot flashes already. They're like, ah, no big deal. We're just going to remove those ovaries and your uterus now, and it's not a big deal. You're already almost menopausal. Who cares?
Yeah.
Well, actually, a post-menopausal ovary that's still present, is making testosterone, and it is actually making very low levels of estrogen. So surgical menopause, even in that natural age of menopause woman, is still different, right? And 1 in 8 women in the US, Rachel, this is crazy. 1 in 8 women will lose their ovaries prior to the age of natural menopause for benign reasons, meaning non-cancer reasons, right? And less than 50% of those women are offered hormone therapy, which is the standard of care, because the long-term morbidity and mortality of untreated premature surgical menopause is huge, upwards of 70, 80, 90% increased risks of dementia, osteoporosis, cardiac disease, you name it, right? So if you're early, you must have full HRT. If for some reason you can't, which I wonder about this patient's questions, will we be okay? If you're surgical menopause and you absolutely, for whatever reason, cannot take systemic estrogen therapy, you can still be okay. You are not destined to a life of cardiac disease, fractures, and dementia. But you better demand from your doctors that they are going to talk to you about all the other ways to help mitigate either symptoms or chronic disease risk. And that's the problem, is those patients are often forgotten about. Will you be okay? Yes. Will you need to advocate for yourself and really get educated and be super proactive? Hell yes.